Welcome and thank you for watching the second episode of our Top Trends in Healthcare video series. These videos are a series of discussion with industry experts that aim to shed light on current trends shaping the future of health and life sciences. I'm Molly McCarthy, National Director and U.S. Industry Advisory Leader for Providers and Plans at Microsoft. And today we're so happy to have Jane Sarasohn-Kahn joining us to discuss the topic of expanding care at home and the impacts it will have on transforming the healthcare journey. Welcome, Jane.
Thanks, Molly. I'm so delighted and grateful to be with you for this.
Well, I just wanted to give our audience a little bit more information about you. So Jane is a health economist, advisor, and founder of Think Health, a strategic health consultancy firm. In 2007, she launched the Health Populi blog, where she focuses on people, health, and technology. I'm so excited to talk with her about how the landscape of healthcare is changing. And I know we've had many conversations over the years, but specifically how innovative technology can help deliver quality care and service to patients. So Jane, my first question is, I'm looking for you to shed a little light on what care at home or care everywhere is, and why is it so timely for us to be talking about it?
Well, many factors have been converging since before the pandemic, but the pandemic really accelerated so many of these trends. So we'll start with telehealth in general, which is sort of what everybody thinks about as the technology for care at home, but it's of course much broader than that. Before the pandemic, we saw take up of telehealth amongst younger parents who, on Saturday night or Sunday morning, had a sick kid. I know I was one of those early on. And then take up of some telehealth, telemedicine technologies amongst younger people, digital native types, who didn't have a medical home to go to in our parlance. But in COVID-19, with the lockdown and medical distancing, of course, more people, millions of people globally and in the US, of course, experience some aspect of virtual care for the very first time. And it's kind of stuck, and we'll talk more about that. So that's one issue in terms of this perfect storm, setting up care at home and really care everywhere or anywhere. The home became the health and wellness hub for a lot of health consumers, right? More DIY health. And then more generally, through being home more for school, for work, for fitness, for faith services, people got more into e-commerce. So Prime subscriptions went up again in many countries besides the US, but especially in the US. And people used e-commerce who never used it before, particularly older people, figuring out, oh, I can actually order my toilet tissue online in short supply. I could find it. So again, we see these base platform technologies, the smartphone take up, the use of e-commerce, which now people are pivoting for use for health and well-being.
Great. Well, thank you. I think that helps really understand the evolution and the continued growth in this area, both from the perspective of the patient. We haven't necessarily talked about the payers yet, but we'll get there eventually. I'm just wondering how the concept of care at home and care everywhere has the potential to change, how patients are really interfacing and interacting with not only their care providers, but how their conditions are treated. And you mentioned care at home can help solve some of the challenges that we definitely saw during the pandemic, but we continue today. What do you think some of those key challenges and key forces, aside from COVID-19, are really influencing where patients receive care?
There are a couple of what I've called toxic side effects to COVID-19, the pandemic aside. Mental and behavioral health issues, which were very poorly served in terms of access, health resource shortage areas in the parlance of the government. But the good news, again, the opportunity, can't waste a crisis opportunity here, as Winston Churchill suggested, is that tele-mental health and behavioral health really filled a gap that was there before the pandemic, but during the pandemic, people really copped to the fact that I'm anxious, I'm depressed, I'm stressed. And so this is one of the good news issues, the pearls that came through the pandemic. And really, when we look at the uptake of telehealth today, the most persistent use of it amongst patients and consumers is for mental health and behavioral health. That's lasted the longest and persisted. So people are getting benefits out of it. Now, when we think about our healthcare, omni-channel is a way we've been living in the pandemic. For example, if you had an acute arising of a condition or a flare up of something, you might have gone online to a direct to consumer telehealth company or to your own physician or health system, which quickly pivoted to provide telemedicine. And we have to applaud the hospitals who came online so quickly and heroically to do telemedicine, telehealth. Those visits could have been in real-time video, as you suggested earlier, but it could also have been an encrypted, safe, secure, HIPAA-compliant email to a clinician, a nurse practitioner, a health coach, any number of individuals through that digital on-ramp who would then get back to you. Otherwise, you could have connected with an EER, an electronic acute care situation where you would have called your 800 number from your health plan, et cetera, to figure out what that on-ramp would be. But there are many omni-channel ways to get healthcare now, from the traditional retail clinic, urgent care clinic, obviously the ER, the inpatient hospital, but also we have to start thinking about the pharmacy, the grocery store as a health destination, which I'm sure I'll talk about again because it's one of my hobby horses where I'm spending time these days. And then you think about the home care visit to your home as one of the channels. So you see, you have these different bits of a platform that is the omni-channel, your platform of many places to go for your health. And that's proliferating like mad now, both in terms of your own health system, your branded local health system, the university academic medical center system, which has lots of digital on-ramps for you in different ways. And then the retail side of things on the other side also are coming toward the center of care, primary care, when the legacy health system, the brick and mortar health system, is moving toward there. And this middle area, this primary care area, is the hot thing to think about right now.
We think about Omnicare. How do we actually make that a reality, both from a technology perspective, even an interoperability perspective? I know those are lofty goals, but would love to hear your thoughts.
We can't get there until we cop to the fact that healthcare is a data-driven enterprise. There's lots and lots of data, and it's not all in the electronic health record that our incumbent health system has. Because if you live in my world as a health economist, broadly speaking, that health is more than health care. Health is made where we live, work, play, pray, learn, and shop. In the kind of work that I do. So we look at people's lives and we first think about care to the home means we have to be connected at the home front and on the go. So at home, we learned in the pandemic, a lot of young people could not do school at home because they didn't have Wi-Fi or even a consistent cell service if they could use it, say a tablet. Via a cell connection. So that's one of the new Maslow basic hierarchy of needs, right at the bottom of the pyramid: food, shelter, housing, Wi-Fi. Really important connectivity. And I've been talking about this for a while. Connectivity is a determinant of health, a driver of health.
You talked about social determinants of health, and you talked about Wi-Fi and access, and I want to hit home on that really, because I think when we think about access to care and equity, Wi-Fi is so important, that connectivity. That's one point I want to just reiterate. The second really is thinking about who is appropriate to have care at home, because it's not just about the patient, but their surroundings. What is their community? What is their support system? That's, if not more critical than the actual remote patient monitoring device sometimes in my mind. And thinking about that, you also mentioned it really takes a village, and it does.
But if we have health coaches, nurse practitioners, folks who are taking on risk in a value-based sense, Medicare Advantage, for example, which can offer many of these services, including transportation to a doctor's appointment, for example, we've got the start of making this work beyond just the incumbent healthcare system, but a collaborative around the person, her values, her clinical needs, her social and psychosocial needs as well. I love thinking about how do we make this work with trusted touch points.
That's great. I think what I'm hearing from what you started with in terms of value-based care and valuing what the patient cares about is truly a system that is patient-centered, which sounds somewhat simplistic, but really, that's what we're driving for. I think, though, what we want to do moving forward is really take action. And you talked about it, partnerships. I think that is so key, and working together as a team to really transform healthcare. And I've seen a lot more of that in the past few years, especially post-COVID. So I just wanted to say thank you, Jane, for taking time out of your schedule to speak with us today, and really enjoy the discussion. And if you're interested in learning more around our series of top trends in healthcare, we will have a couple of other editions coming out soon. So take a look, and we look forward to seeing you back here soon. So thank you, Jane, and take care.
My pleasure. Thanks, Molly.